If you've just joined us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. I'm here to answer any health questions that you might have, so feel free to leave a question in the comments and I will get back to you. So why don't we talk about a really popular topic, and that is cortisol. So let's talk about cortisol. So there's high cortisol, and then there can be lower cortisol. So let's talk about cortisol, what that looks like. So what is cortisol? So cortisol is a hormone. It is released from your adrenal glands, and these are glands on your kidneys. Cortisol, it's actually a very important hormone. It tends to get a bad reputation because we hear like cortisol means stress and this and that. But yes, it can mean stress, but basically cortisol can help regulate your body. It can help with regulating blood sugar, blood pressure, so many different things in the body. So if cortisol ends up getting too high or too low, then that's when we start to see issues in the body. So what are some symptoms of high cortisol? So have you ever felt tired but wired? Does anybody know? Has anybody felt that way? Yes, Mr. Cameraman. That tired but wired feeling, that is usually a high cortisol. So it means like you feel tired, like you need to relax, but then your mind and your body is kind of wired and you're not able to calm down. So that's usually a symptom of high cortisol, that tired but wired feeling. So hi everyone, if you've just joined us, I'm Dr. Amanda, naturopathic doctor. This is the Let's Talk Health live stream. I'm here to answer any health questions that you might have. So if you're just joining us, make sure to subscribe on YouTube, follow on TikTok so you get updated when I go live, and then also like this video so that way I know you found it helpful. So right now we're talking about cortisol, but you can also comment on anything you want in the chat box, completely open. Okay, so if cortisol is high, you're going to feel tired but wired. You're also usually going to crave sweets. Crave sweets, like cookies. Can we draw a cookie? Does it look like a cookie? A little chocolate chip cookie? So if you usually have high cortisol, you're craving sweets. That's a very common thing to have with that high cortisol. What else? What else happens when cortisol is high? Usually you then feel irritable. Okay, if you know your partner says something and you just like snap at them for no reason, that's irritable. That's usually cortisol is high. Okay, so those are some signs of higher cortisol: tired but wired, craving sweets, irritable. Another one is not hungry in the morning. So if you're not hungry in the morning, usually that's a sign that stress is a little bit high. Generally with cortisol, it actually should peak in the morning. Like it is important to help us get out of bed, get us throughout that morning. But if you're not hungry in the morning, then that's usually a sign that your cortisol is probably a bit too high and your body's in that fight or flight mode and you're not wanting to eat. Okay, so we've been talking about cortisol. We talked about high, so high symptoms of cortisol. So if anybody just joined us, welcome. I'm Dr. Amanda, naturopathic doctor. Welcome to the Let's Talk Health live stream. I'm here to answer any health questions that you might have, so feel free to leave any questions in the comments. Thanks for joining us. Thanks for watching. I'm talking about cortisol, but you can ask me about anything else.
We have a question from Ava. What do I do to help anxiety?
Okay, what do we do to help with anxiety? So anxiety is usually a nervous system response. So you're in that fight or flight mode, what we talked about. What we want to do is activate that rest and digest, that parasympathetic nervous system. So there's a few things that we can do. Let's talk a little bit about some lifestyle techniques, and then we can talk about some like supplements and herbs. So in terms of lifestyle techniques for anxiety, what you want to do is things that are going to be calming and grounding. So yoga and Pilates and walking are really good for doing that. So making sure you do something every day, whether it even be going for a 10-minute walk, can be so helpful for reducing anxiety. Another thing is just even doing deep breathing. So maybe in the morning, if you notice that's when your anxiety spikes, sit down in a chair, do some nice deep belly breath. So breathe in and out. That can really help with activating that parasympathetic nervous system. So what did we say? Lifestyle, walking, yoga, breathing. You want to incorporate those into your daily routine. Now let's talk about some supplements and herbs. So in terms of supplements, magnesium and B complex are a great way to help with anxiety. So magnesium is a mineral. It's really calming. I usually like the glycinate or the malate. Those are both really nice calming magnesium forms of magnesium, that can help with like relaxing your nervous system, relaxing your muscles. So magnesium. And then another one, I talked about this before, was lavender. So lavender is a really great herb to help with calming down the nervous system. So that can be kind of taken as needed when you're feeling anxious. Another thing that you can do is look into other ingredients like amino acids like L-theanine. It's really helpful for providing mental clarity, not making you drowsy, but helping you feel calm. And that's actually found in green tea. So it doesn't have caffeine in the actual supplement, but it's part of green tea. Okay, so the question we had, if anybody's just joining us, somebody had asked, what can we do for anxiety? So thank you for asking that question. My answer was you can do some yoga, some deep belly breathing, making sure you're going for a walk, and then we talked about magnesium, lavender, and L-theanine. So if you found that helpful, it was Ava, I think. If you found that helpful, make sure to like this video. If you're new to my channel, make sure to subscribe.
Okay, another question.
Yeah.
How to fix a leaky gut, and can being underweight play a role?
Okay, how to fix a leaky gut, can being underweight play a role? Great question. So I have a video, if this was from TikTok. Okay, so I actually have a YouTube video all about leaky gut. So go check out my YouTube channel. Follow me on there and you'll see one of my videos was all about leaky gut. So in terms of leaky gut, and if anybody just joined us and they don't know what leaky gut is, basically in your gut, now we'll kind of just go over here for a second. You have like your gut cells, like this, and then this is another one. Those are your gut cells. So they should be nice and like tight together. If you have leaky gut, what you have is a little bit of space in between them. And then what can happen is this is your intestine, and then this is your bloodstream, and then food particles from your intestine will go into your bloodstream. So then what happens is, it's called leakiness because things are flowing through. They should stay. Are we laughing at my drawing? Okay, it looks kind of funny, but they should stay in your intestine. They go in your blood, and then what can happen when you have leaky gut? You have symptoms other than just gut symptoms. You might start getting things like brain fog, and itchy skin, acne, eczema. Maybe you're getting other things that like thinning hair or hair loss, or even just gut things like bloating and constipation, diarrhea. So that is leaky gut, but what you want to do is figure out what is causing your leaky gut. Now it always goes back to root cause. So if anybody's just joining us, we're talking about leaky gut and what can cause leaky gut. So maybe you have a bacterial or a yeast overgrowth, and the way to know that would be to do a stool test to see. Or maybe it's stress. Stress plays a huge role in our gut and our immune system. So figuring out if stress is the cause of it. Maybe it's something more inflammation going on, like maybe you have colitis or some sort of intestinal inflammation going on that can be causing the leaky gut. Maybe it's a lot of food sensitivities, or you have a food allergy or an intolerance that maybe you don't know about and then it's causing that issue. So that would be step one, to figure out what's causing your leaky gut, and then in order to help fix it, some of my top tips for this are choosing foods that are soothing and easy to digest. So if anybody's just joining us, hi and welcome. I'm Dr. Amanda, naturopathic doctor. We are talking about leaky gut here. We had a question about how to improve leaky gut. So I kind of talked a little bit about what can cause it. So now we're talking about what you can do to help improve it. So foods like bone broth is really good. Berries, things that are high in antioxidants, chicken broth, all of those are really helpful and soothing. Aloe is also great. And then in terms of supplements, L-glutamine is a really good one. So it's an amino acid. It helps with improving the tight junctions. So that's one to look into. And then zinc, a specific form of zinc called zinc L-carnosine can help out with that as well. And then your question was asked about underweight, if underweight can cause it. Not necessarily, unless you were severely underweight for some reason, like if it was because of colitis or IBD, or if your stress was causing you to be so underweight, then that could be related to it, but I don't think underweight directly would cause the leaky gut.
Can you discuss benzodiazepines?
So benzodiazepines are anxiety medication. So generally what they do is they try to work on the nervous system, calming it down, but they can be like quite addictive using them long term. So generally something like a benzodiazepine you want to use short term, whereas SSRIs, those are different. Serotonin medications, those ones are usually used more long term. So with a benzodiazepine, I usually say like that's supposed to just be something short term or kind of as needed. And that's kind of where I was talking about, like lavender can kind of be used as needed. Sometimes it's worth it to give it a try to see if it would be a good alternative to taking that.
How do we reduce our cortisol levels?
Yeah, so high cortisol. So if you have high cortisol, if you're tired, wired, you crave sweets, you're irritable, you're not eating in the morning, how do we reduce that? So kind of similar when we talked about the anxiety, if you're just joining us, I said doing some exercises that are going to be more grounding and calming. So that would be things like yoga and walking, but also strength training is really good. I would avoid things that are more higher intensity around those times that you're feeling more anxious and having more of the high cortisol. Doesn't mean you have to completely avoid them, because it's still great to get some cardiovascular support, but definitely doing things more like yoga, walking, swimming. And then some herbs that I really love. So herbs are licorice root. Okay. And maca. So licorice root, maca, those are really good. What else? And then lemon balm. So really good if you're really stressed out. Licorice is great for the adrenals. If you have high blood pressure, just caution with that. Maca is a nice herb that's grounding, but it also can give you some energy support too. And then lemon balm's really good, really calming. If you have a lot of digestive concerns and you're like anxious in your gut, you gotta do lemon balm. That's a really good one. But that was a great question. Thank you for the questions, everybody. I really appreciate it. If you're just joining us, make sure to like this video. If I answered your question and you found it helpful, make sure to like the video. I'm streaming both on TikTok and YouTube, so follow me on both of those channels. I do have a lot of good information on my YouTube videos about gut health, so if you've never checked that out, go look at that there. Okay.
Can I cook chips using Castrol GTX?
What? Like for the engine?
Yeah.
No. No, you can't. I wouldn't recommend
I think that was a
doing
joke.
I wouldn't recommend doing that.
Is it true that benzodiazepines, when used for years, can increase risk of developing dementia?
I'm not 100% sure on that. I'd have to look into that, but I would say long term they shouldn't be used. So potentially there are some more serious side effects with them. Mm-hmm.
Okay. What are your thoughts on PRP, platelets, rich plasma, far as injection for pain, hair regrowth, and or cosmetics?
Yeah. So actually at the clinic that I work at, we do that. I personally haven't been trained on it, but if you're in California, we do that at the clinic that I'm working at. So I have seen just like secondhand, I can't say firsthand experience because I haven't worked with patients doing that, improvement with hair growth. So with PRP, yes, I've seen that. And then with joint pain as well. Now, I would say it's something that you need to kind of discuss your individual case with a practitioner, because it's not for everyone. It might not work for you, but definitely talk with somebody that's trained in that. It is a good option if you were looking for other routes for pain management or improving hair growth. Great question. Thanks everybody for the questions. If you've just joined us, this is Let's Talk Health live stream. I'm Dr. Amanda. I'm here nightly, every night, just to chat with you guys, answer your health questions. We talked a little bit about cortisol, we talked about leaky gut, anxiety, so feel free to drop your questions in the comments. Make sure to like the video if you are just joining us. It really helps get my video noticed across the YouTube and TikTok live streams.
What about benzodiazepines for preventing and stopping seizures?
I think there are more suitable medications for those. Now, again, not my area of expertise, but there are some medications that are more specific for seizures. They could potentially help, but in the moment, generally somebody that's having a seizure, you need to let them like play it out. Now, I was talking the other day about the keto diet and how that can be helpful for epilepsy. It's actually been studied for that. So that's something that you have. I would look into the keto diet for specifically for epilepsy and seizures. Yeah. Thanks for the question. Good question. Okay. Anything else right now? Otherwise, we'll kind of continue this chat here about cortisol. Okay, so we talked about high cortisol. What about low cortisol? So low cortisol, you are exhausted. Like you're just feeling really depleted, usually throughout the day, but especially in the morning, you're gonna be tired on waking. So when you wake up, you're tired. Remember how I mentioned cortisol, it should like spike up in the morning? Well, if your cortisol is low, you're just gonna feel exhausted, you're gonna feel tired in the morning. Another thing is you're going to, instead of craving sweets, you're gonna crave salt. So things like chips, salty foods. Now, that being said, everybody can have cravings for certain things, but if you really are noticing you're wanting more of those salty foods, cortisol may be low. And cortisol, again, I talked about how it's from your adrenal glands. These are glands on your kidneys. Kidneys regulate blood pressure, so it kind of goes along with that. So you're going to feel exhausted, you're going to be tired, you're going to be just craving some salt. So those are some low cortisol symptoms. Now, what can we do to help? So, with this one, swimming is a really good one. So just some general exercise, walking, and then electrolytes. So electrolytes can be really beneficial if you have low cortisol. Electrolytes are basically your minerals, sodium, potassium, magnesium, mixed in a powder, and then you take them, mix them in your water, and those can be really helpful for low cortisol, just for giving your body some nourishment. Another one is bone broth. Bone broth is really good and nourishing, especially if you have low cortisol. So if anybody has questions about high or low cortisol, let me know, or if you have any other questions, let me know as well. And if you're just joining us, hi and welcome. I'm Dr. Amanda, naturopathic doctor. This is the Let's Talk Health live stream. I'm here to answer any health questions that you might have. Thanks for dropping by. Feel free to leave your questions in the comment box and I will answer them for you. We've had some great questions tonight about anxiety, about leaky gut, so many different things. So this is cortisol, but we can erase this and we can talk about some other stuff.
Would it be safe to drink a herbal tea if you're underweight? How many times would you suggest?
So that's a good question. Yeah, so I would say you could still drink it, but then thinking about if you're really underweight, you would want to do less of the dose than what's recommended. So let's say 1 teaspoon of the loose leaf herbs is what's recommended for a certain, let's say chamomile or something like that. You might want to do just a little bit under that. Kind of like how you would do it with kids. You basically usually do things based on their weight. So until they become like an adult weight, then things are dosed based on their weight. So if you are underweight, then I would say just doing a little bit less than the dose. But it's still safe to take. I mean, of course, I don't know your medical history, so just making sure that you always check with your provider. But yeah, good question. Thank you for the questions.
What are your thoughts on taking high levels of vitamin D, 20-30,000 IU?
So 20-30,000 a day?
Yeah.
So we've talked a lot about vitamin D on here, and I'm going to just repeat myself that I've talked about it before. I always think it's best to get your levels checked before you do something high dose. So high dose like that, if you were taking that much every day, one of the side effects or the risks of high vitamin D is having kidney stones. So that's one thing just to keep in mind. You may not need that much, so I would say getting your levels checked so that way you know. Vitamin D is fat soluble, so basically it will stay in your body, whereas something like vitamin C and your B vitamins, you're just going to urinate excess of them out because they are water soluble. So you're more likely to go into vitamin D toxicity than you are with something like a B vitamin. So I think it can be helpful if you are deficient and you really do need it, but just being careful because you could go overboard with it. And another thing to remember with vitamin D is sometimes a vitamin D deficiency can actually be magnesium deficiency. And magnesium is a mineral not a lot of us get if we don't have a lot of things like leafy greens and nuts and seeds. So you may want to consider taking magnesium in addition to the vitamin D. Maybe you don't need that much vitamin D and see if that helps.
Jake asks, what do you think about United Healthcare having the most denial rate in the United States?
Oh, yeah. I haven't really looked into it that much, just from what I've heard. I think it's the insurance industry, it's very tricky because, you know, we pay for our benefits, we want to receive certain care, and then you're denied that care. And I think that's really unfortunate. I think it's unfortunate the way sometimes our traditional medical system works, which is kind of why I went more into like naturopathic medicine. Yes, you have to pay usually out of pocket for it, but you really are being heard and you have somebody that's going to be on your team and advocating for you. So I would say, yeah, it's unfortunate when people's claims are denied and they're not able to get the care that they should receive. But yeah, thank you for the question. All right, so this is, if you're just joining us, hi everyone and welcome. This is the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. Feel free to ask any health questions in the comments. We've had some great questions so far about anxiety, about leaky gut, about vitamin D. A lot of people ask me about vitamin D, so if you missed that, feel free to ask me about that. We had some questions about healthcare and insurance. Yeah, so we were talking about cortisol. We talked a little bit about leaky gut. What else? Any other questions so far? No, let me get some water. So if you are also just joining us, welcome to the Let's Talk Health live stream. I'm streaming both on TikTok and YouTube, so if you're following me on one channel, go check out the other one. I do appreciate if you were to subscribe, like the video, join the community here. I go live daily, so it does help if you're following, that way you know when I go live. Okay. We talked about, why don't we talk a little bit about magnesium? So magnesium, there's different forms. So there's the glycinate form. That's the one that I was talking about, is good for anxiety, for the nervous system, for sleep. Stress as well, really good. Then there's, I don't think I mentioned it tonight, but the citrate. This one is pretty good if you're constipated. It can also help with sleep a little bit too. Constipation. But it's one of my go-tos. If you're feeling constipated, a little bit backed up, taking something like that, about 400 milligrams in the evening, can help you pass a nice bowel movement. It's not a laxative, so it's not something that's just gonna all of a sudden make you go, but it helps with drawing water in the intestines and helps you have a bowel movement. Okay, then the other one, malate. So this one is really good for muscle aches, muscle tension. If you are somebody that really works out often, that would be a good one to take. If you have a certain condition like fibromyalgia or EDS, any rheumatoid arthritis, that would be really good. So muscle tension. So we have these three so far: anxiety, sleep, stress, constipation, muscle tension. And then there's the 3 and 8, and that's for cognitive health. So things like brain fog, difficulty with remembering things, or if you just want some extra cognitive support, that's a good one for that, the 3 and 8. So those are pretty much the 4 popular ones. Oh, there's also taurate. Let's go for the heart. Has taurine. So usually magnesium, what it means is basically it's like has a usually amino acid added to it. So like magnesium glycinate is like magnesium with glycine, like the amino acid. It's a calming amino acid. Why don't you guys write in the comments, like which one of these do you think you need out of these 4 magnesium? Which one do you need? Let me know and put it in the comments below. Hopefully you can read my writing. But yeah, if you're just joining us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. I'm here to answer any health questions you have. Be sure to like this video if you've been joining, if you've been watching and you found it helpful. If I answered your question and you found it helpful, make sure to like it so that way I know you found it helpful and it gets our video noticed across the live stream channel. If you're new to my channel or if you're new to my community, make sure to subscribe. It really does help increase my visibility across our channels, and then you also get to know when I go live because you'll be notified and then you won't miss it. And then if you have a question tomorrow, we'll be able to answer it. All right.
What supplements would be good while on chemo?
So supplements for chemo, so you have to be careful. Usually when you're on chemo, a lot of things are not really recommended to do because you don't want to interfere with the chemo. So that's something you have to discuss with your healthcare provider. But when you're not doing chemo, then there are some things that can be helpful. So high dose vitamin C can be helpful. Again, double check with your provider if that's okay for you to do. But high dose vitamin C can be beneficial. A general, a multi-strain probiotic. So probiotics are beneficial bacteria, good for your gut health, and our gut contains like 80% of our immune system. So if we're thinking about cancer, if we're just thinking about health in general, we want to improve our immune system. So probiotic is really good for supporting the immune system, the gut health, the microbiome. And then Vitamin D. Vitamin D is also a really good one. Again, seeing how much you can take, talking with your provider, and then even just a general multivitamin. So a multivitamin where you're getting all your vitamins and minerals. A lot of times with cancer patients, unfortunately, they're not able to eat as much. I've experienced that firsthand with a family member. It's hard. It's really hard to eat and just get enough nutrients in. So a multivitamin can be really beneficial. I would say focusing more on those things rather than worrying about things like herbs and stuff like that. So making sure you're getting enough protein in your diet, maybe looking at some protein shakes, especially if you're getting chemotherapy. You want to make sure your body's still nourished and nutrient dense diet. But thank you for that question. If it's you or if it's somebody that that's going through that, I'm sorry to hear that and wishing them all the best, because that can be very, very challenging. But yeah, I would say look into working with a healthcare provider in your area that it does alternative medicine that can help with cancer therapy, but works collaboratively with your oncologist that knows what they're doing, and that way you can have a good plan where you're able to be supported in both ways. But thank you for the question. If you found my answer helpful, make sure to like the video. If you guys are just joining us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. I'm here to answer any health questions that you might have. If you're new to my channel, if you're new to my page, make sure to subscribe and follow and join our health community here. If anybody's just joining us, I was talking a little bit about magnesium. So let me know, which one of these magnesium do you think you need? Do you need the glycinate for anxiety, sleep, and stress? Do you need the citrate for constipation? Malate for muscle tension? Threonate for cognitive health? And or taurate for heart health? Usually the ones that I personally go to are either going to be the glycinate or the malate. I find it really helpful if after a workout, or even just like sleeping the wrong way, or just feeling some muscle tension. A combination of those two I really like, and this one's really nice for calming the nervous system. But yeah.
Thoughts on a COVID shot?
So I would just say with something like that, to make sure you're doing your own research. I can't tell you if you should do it or not. It's not really in my scope to talk about, vaccines, if you should get them or not. Depending on the population, some, if you're elderly, if you're immunocompromised, it might be helpful in that case. If, you're generally healthy population, maybe you don't need it, but I would say it's something to more so look into, do more research on it for anything that, of course, with anything that you take, just make sure you're doing your research on it. But that's what I would say my thoughts are, kind of mixed on that one.
Have you ever read Edward Griffin's book called A World Without Cancer?
No, I have not. Tell us a little bit about that. Has anybody on the stream read Edward Griffin's book, The World Without Cancer? I have not read it, but it sounds like a nice world if there would be no cancer. Yeah, it's a pretty awful disease. But please let us know. All right, if you're just joining us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor, here to answer your health questions. We talked about leaky gut, anxiety, magnesium. I was talking about cortisol before. So if there's anything you want me to recap and answer, feel free to ask. And I will be able to answer them for you. And thanks for joining us.
Is it important to take folic acid before pregnancy?
That's a good question. So I would say it's not absolutely necessary. Like, it's definitely necessary. You want to take it in pregnancy to prevent neural tube defects in the fetus. But a good thing about taking it before is it kind of just helps your body get ready, and it gets you also in the routine of taking it. I've talked a little bit about fertility on here, and just like if you're trying to conceive, you want to try to start about 3 months before getting your body ready. So it is a good idea to do a prenatal supplement that has folic acid in it about 3 months before. But if, you know, all of a sudden you did conceive and you are pregnant and you didn't take folic acid before, that's okay. Just start taking it as soon as you know that you're pregnant. I think one of the benefits of taking it before is, like, if there's that chance that you got pregnant and then you didn't realize, you may already be taking the folic acid, which is good and beneficial. But yeah, that's a great question. Usually around like 1 milligram of folic acid is recommended.
G. Edward Griffin, Laetrile, and amygdalin vitamin B17 banned in the US. Read that book, it's incredible.
Okay, interesting. Never heard about it, but I will check that one out. And if anybody's on the chat has read that one, feel free to let us know your thoughts on it. So,
what can I take to sleep within an hour of taking?
Usually melatonin is going to be the one that's going to help you sleep within an hour of taking it. It does kind of help calm you down. And
does it cause lucid dreams?
Melatonin can. It can cause those vivid lucid dreams for some people. Can make some people groggy in the morning. So I usually recommend, if you're doing melatonin, start with something small, just like 2 milligrams, 3 milligrams. I've seen some people taking 10 milligrams. That's way too much.
Mm-hmm. So I think it would be better to maybe find the root cause of why you can't sleep first, right?
Yes, maybe you're that high cortisol that we're talking about, that tired but wired feeling. But yeah, of course, figuring out what's the root cause. Why aren't you sleeping? Are you anxious? Is there something else going on in your life that's causing you to sleep? Do you have sleep apnea? Do you have diabetes? Do you have high blood pressure? Like, all these things can impact sleep, and sleep is so important. So caffeine, good one, good point. Caffeine can definitely do that. But looking at that, and then yeah, of course, if you needed some support, melatonin is one. There are some herbs that can be helpful. Things like passion flower and valerian root. Those are some herbs that can be helpful also with calming you down, helping you sleep. But yeah, thanks for the questions, everybody. If you're just joining us, welcome to Let's Talk Health livestream. If I answered your question, or if you're just watching and you found this helpful, make sure to like the video. Check out my YouTube and my TikTok. I go live on both of those. I'm here to answer any health questions that you might have, and make sure to subscribe so that way I get notified when you go. You get notified when I go live. Yeah.
What are some symptoms of pregnancy before period date?
Yeah. Some people can get nausea. So some people get morning sickness pretty early on. Honestly, some of the pregnancy symptoms kind of look like PMS, like you're going to get your period symptoms. So you can have some soreness or tenderness in the breast area. You could get some mild little cramping, some lower back pain. You could feel tired and fatigued. So those would be some early symptoms of pregnancy. But then sometimes you might not have any symptoms at all, and that doesn't mean you're not pregnant. You can just have no symptoms, because it's really only going to be like that 2-week period between when conception would have been at its highest, or your fertility, to when you're supposed to get your next period. So you might not get any symptoms at all. Yeah. But good question. Thank you. If you have any other questions about that, just let me know. All right. Anything else? Okay. All right, everyone. So if you're joining us, if you've just joined us, welcome to the Let's Talk Health live stream. I'm going to hang around for a couple minutes, and I'm going to end this stream for tonight. I'll be back tomorrow. So be sure to, like I said, subscribe, follow, like the video. That way you get noticed or get notified when I go live. You can turn on notifications as well. And then just check back when I come live, and you can ask me a question again tomorrow. And yeah, I think that will wrap it up then for the rest of the night. Okay, thanks everyone for joining. I will see you all tomorrow. Have a good night. Bye.